Hi, it's Nathan. Today we're talking about risk management procedures. So in relation to health and safety or environment and quality, we're talking about health, safety and environmental quality risk management procedures, not those general sort of risk management. I forget what the standard is, like 31,000 or something, which is like financial and corporate risk. We're just talking about HSEQ risks. The HSEQ risk management procedure, or WHS, or safety risk management procedure, is just a document that outlines how we manage those risks in our organization. It's an easy one to write, particularly from a safety perspective, because there's a code of practice, how to manage WHS risks, which basically outlines the legal requirements in relation to risk management for health and safety. And then there's so much overlap between safety, environment, and quality that you can sort of just use the same processes. So the risk management procedure basically has 4 steps. We identify the hazards, we assess the risks, we control the risks, and we monitor and review. And then within the procedure, will have like a breakdown of how we do all those different things. So for hazard identification, we will say that, we review industry guidance, we consult with workers, we do safety inspections to identify hazards. To assess risks, it'll have a copy of your risk matrix in there and say this is how we assess risks and this is when we assess risks. Then we'll talk about how we control risks. You'll generally have a copy of the hierarchy of controls in there. And then you'll talk about, how you control different risks. So you might talk about the operational documentation that you have to sort of help implement those controls. And then monitor and review, which will typically just be how you monitor and review your risk management. So things like safety inspections, internal audits, maybe some external audits, management review meetings, consultation with workers, another good way to review risk management effectiveness. So yeah, hope that helps. See you next time.